Imagine being told your emotions, your pain, even your fainting spells, are all because your uterus is wandering around your body. Sounds absurd, right? Well, welcome to the strange, fascinating, and sometimes disturbing history of hysteria. In ancient Greece, hysteria was thought to be a women's disease caused by a wandering womb. Yes, you heard that right. They believed the uterus could literally travel around the body, causing headaches, choking, seizures, or sudden mood changes. Doctors prescribed marriage, pregnancy, or even fumigations, blowing scented smoke into the vagina to lure the womb back to its proper place. Medicine, my friends, was very creative. As medicine merged with superstition, women showing signs of hysteria, convulsions, uncontrollable laughter, or paralysis were often branded as witches or possessed. The treatment? Exorcisms, prayers, or worse, execution. Hysteria wasn't just a diagnosis, it became a weapon to control women, linking their bodies to fear and shame. Fast forward to the 1800s, and hysteria became one of the most diagnosed illnesses in Europe and America. Doctors described hundreds of symptoms: anxiety, fainting, irritability, even excessive sexuality. One famous neurologist, Jean-Martin Charcot, put hysterical patients on display in Paris like medical theater. A young Sigmund Freud watched these shows and later developed his theories of psychoanalysis, linking hysteria to repressed trauma. And here's a wild fact. Some doctors treated hysteria with pelvic massages, claiming it relieved hysterical paroxysm. This bizarre medical practice eventually led to the invention of the first vibrators. By the mid-20th century, hysteria faded as a medical diagnosis. Science realized it wasn't a single disease at all, but rather a mix of conditions like epilepsy, anxiety, depression, and trauma disorders. What hysteria really reveals is less about medicine and more about society's fears, especially about women's bodies, emotions, and power. Today, hysteria is a historical ghost, a reminder of how medicine can reflect culture, prejudice, and even imagination more than reality. So the next time you hear the word hysterical, remember, behind that word lies centuries of wandering wombs, witch trials, Freud's theories, and a very unusual invention. History of medicine is full of mysteries, some fascinating, some disturbing, and some just downright bizarre. What do you think? Was hysteria a case of medical misunderstanding or a way society controlled women? Let me know in the comments below. And don't forget to like, share, and subscribe to the Medical Mystery Zone, where history, health, and mystery collide.